This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubaida Hamid, your host for today. How did the rapid decline in the population of vultures in India affect human beings? A new study, published in the American Economic Review, says that because these birds went nearly extinct, India had about 500,000 additional deaths from the year 2000 to 2005, and the economic damages to the country amounted to nearly $70 billion annually. How did this happen? Up until the early 1990s, vultures were a familiar sight in India. Estimates indicate the country had about 30 million of these birds, but in the 20 years following 1994, the vulture population was decimated. Only a few thousand now exist, and they are listed as a critically endangered species. What happened to them? Diclofenac, a drug that began to be used by farmers to treat their cattle, is believed to be the main reason. When vultures consumed, as they always do, dead animals or carcasses that were treated with this drug, they began to die as it was poisonous to their systems. It took some years for the link between the drug and the vulture deaths to be established, and the drug was eventually banned for animal use, but too late for the vultures in India. So how did the loss of vultures affect the sanitation system of India? What happened to the carcasses of farm animals that were once effectively cleaned up by vultures? Did the population of dogs and rats increase because of vulture deaths? And importantly, how did this contribute to human deaths? We dive into these questions with A.L. Frank, co-author of this paper and an assistant professor at the Harris School of Public Policy, University of Chicago. Hello and welcome to the Hindus in Focus podcast, Professor Frank.
Thank you for having me.
Professor, let's start with the link between scavengers, pathogens, and infectious diseases. Could you explain this to us?
So, what scavengers do in the environment is they remove dead animals from it. I don't think it takes a wide stretch of the imagination to understand or to think about why having a large amount of biomass of rotting dead animals in the environment might pose a public health concern. But broadly, we're talking about a really big source of pathogens and bacteria that, if humans come into contact with, is potentially detrimental to their health. And it can also lead to a source of water contamination if that source of rotting meat gets exposed to surface runoff. That's one problematic channel. The other problematic channel with having more dead animals out in the open is that you get some changes in who are scavenging on those dead animals. And potentially it could be species that come more into contact with human beings, and they spread infectious diseases from the pile of carcasses to human settlements, and that creates another negative channel through which humans are affected.
Let's now get into specifically vultures. What makes vultures unique as scavengers?
What is really special about vultures is they're obligatory scavengers, meaning they don't have a choice between eating a dead animal or preying and killing an animal and eating that one. That means that over evolutionary timescales, vultures have evolved to be very good at what they do. Their stomachs are about 100 times more acidic than ours, and that means that they can descend on a cow, for example, and eat it down to the bone in under an hour. And when they do so, they also serve as sort of like spraying bleach on the environment. They get rid of any pathogens or bacteria that are found at the site, and they just remove the dead animal. They remove that public health concern away very quickly, very efficiently. And they do not come into contact with people that much. So there's a nice buffer of the service they provide without potentially introducing infectious diseases to humans.
So they're very effective.
Extremely effective at what they do, yes.
Tell us a little bit now about what happened to India's vultures.
The short version is that within just a few years, several species of vultures in India declined by more than 95%. And by 2000 were recognized as being critically endangered. That was more or less the aftermath. What happened that led to that dire consequence was a generic approval of a painkiller with the active ingredient of Diclofenac, and meant massive production of cheap and very strong versions of the drug. It was so cheap that livestock farmers started administering it to their animals to help them deal with inflammations and recover from fevers and so on. What they didn't know is that they were inadvertently poisoning vultures, because when a vulture feeds on a carcass of a dead animal that has residue of that painkiller, they develop kidney failure and die within weeks.
So many farmers began to use this drug and inadvertently began killing off the vultures, correct?
Correct.
How rapid was this decimation of the vulture population?
It accelerated very quickly. We know that around 1993 and 1994 is when the drug started to appear in veterinary clinics. 1996 was the first instance when there was this broad realization that vulture populations are in trouble. And at that time, there were already reports of about 50% population declines within just those 2, 3 years after the generic approval. By end of the 90s, most of the populations were already wiped out and affected. So you can think about a population going from around 30 to 50 million vultures, depending on your estimate of choice, down to just a few thousand specimens remaining in the wild by the year 2000.
That is, in about 6 years, millions of birds died.
Exactly.
Now, talk to us, Professor. What happened to the population of other scavengers such as rats and dogs? So now there was a situation where we had no vultures and therefore nobody to get rid of dead cattle. What happened in that situation?
When vulture populations were healthy, they were competing over the dead animals with rats and dogs. When vulture populations were poisoned, died off, and were no longer in the ecosystem, removing dead animals and crowding out dogs and rats had a lot more food, a much bigger food source to rely on, and their populations increased considerably. And that resulted in many more animals that are not as effective as vultures are, meaning they do not consume the bodies of dead animals down to the bone. And also, they come in contact with people. So they were able to spread infectious diseases. And in the case of dogs, the key concern is of rabies transmitted through animal bites.
So the vulture population declined, and at the same time, the rat and the dog population increased, and they were not as good, they were not as effective at scavenging as vultures, correct?
Correct. Vultures extremely effective scavengers, dogs and rats not as effective, and without vultures to compete with dogs and rats, you got a lot more dogs and rats.
So then what happened to the whole disposal system? What happened when farmers found that they had cattle or other livestock who died and there was no vulture to clean them up?
What did not happen is that they didn't substitute for vultures. They didn't start burying the animals, or they didn't build massive networks of incinerators. They mostly kept doing what they did before. They kept dumping the animals in those animal landfills. And instead of vultures disposing of the dead animals, you had dogs and rats doing that. Alternatively, if the animal landfill was too full, or you didn't want to throw the animals there because you were worried about the feral dog packs, there were reports of people dumping dead animals in rivers and waterways as an easier means of disposal.
Which means then that there was far more contamination of water and soil.
With improper disposal of dead animals, either directly into water bodies or just a larger amount of dead animals rotting out in the open, you get higher rates of contamination of drinking water sources due to a surface runoff carrying the pathogens into the water.
Talk to us a little bit about the numbers in India. Your study estimated an increase in human deaths of over 4% because of the large negative shock to sanitation. Talk to us about how you arrived at this.
We first classified districts in India as highly suitable for the vulture species that declined so rapidly in the mid 90s versus the districts that were not as suitable. We did this simply by overlaying the habitat range maps we obtained from this organization known as BirdLife International. Essentially, this divided the country into places that were highly suitable for vultures and were, as a result, more likely to have been affected by that massive population decline versus those who were not as affected because they were not as suitable. We then used that classification to compare districts in terms of their all cause human death rates. And we noticed that in terms of how those districts were trending, they were following the same trend over time up until the mid 90s. Only after the mid 90s, after that generic approval of Diclofenac, after vulture populations began to decline, do we see the places that were highly suitable for vultures diverge from the trend of the low suitability districts, increasing increasing in death rates and experiencing those elevated mortality counts. And that effect began to saturate, reach a new kind of like plateau, a new equilibrium by the early 2000s, when we know that vulture populations were then just a mere shadow of themselves and when they were listed as critically endangered. In essence, we compare the places that received the biggest impact from the decline of vultures to those that were less affected by it, and we observe this really big divergence in human mortality and elevated human mortality in places that were more affected by vultures. There's one more comparison that we do is we recognize that it's not just enough for vultures to decline from high to low levels. You also need a high supply at baseline, a high existing number of dead animals. So we also compare places that had very large livestock herds in the late 80s, early 90s, between the places that were highly suitable to vultures and not highly suitable for vultures. And we do observe that the big increases in mortality happen in the places that are both suitable for vultures and had a big livestock sector in the pre-collapse years.
What were the causes of mortality that you observed? One thing you said was that because of the increase in population of dogs and rats, rabies was one infection. What else?
So, unfortunately, the data that we have does not have any information about the cause of death. So, we can only look at across all age groups, across all causes of mortality, and that's the comparison we report in the paper. In some additional analysis, though, we try to provide some suggestive evidence for those two channels we talked about, rabies and water pollution. We managed to obtain data at the national level on the sale of rabies vaccines, and we see a similar divergence in the trend where there was this elevated amount of sale relative to what just a continuation of the trend from the early 90s would have suggested. And in terms of water quality, we see different indicators such as dissolved oxygen or fecal coliform deteriorate, suggesting a much greater availability of organic matter in the water in the places that were highly suitable to those affected vulture populations.
So, primarily waterborne diseases and rabies is what you believe happened to cause these deaths?
That's what we think aligns with the data that we're able to report at either the district level or the national level, also aligns with some of the more anecdotal reporting and aligns with what other studies in the sanitation literature have found about the key mechanisms that explain mortality and morbidity following usually improvements in sanitation. Our study looks at a case where sanitation actually degraded.
Tell us a little bit about the numbers that you said. So, 4% or something like 500,000 extra deaths per year. Is that what you found?
Not 500 per year. It's more an excess mortality at the annual level of about 100,000 deaths. So if you take account of the period after 2000 up to 2005, we're talking about more than 500,000 additional deaths in that time period.
And the economic damages?
We use a mortality reduction value, also sometimes referred to as the value of statistical life, to value these damages at roughly $70 billion a year. This essentially represents something about the trade off that a society is willing to make in terms of reducing its exposure to a mortality event.
It took some time for the link to be established. Is that correct? Between the diclofenac and the vulture deaths.
Indeed, it took about a decade. It was only in 2004 that a paper by Oakes et al. Was published in the journal Nature and was really able to provide the smoking gun connecting diclofenac to the mortality of vulture populations. So the country spent a decade roughly really not understanding what is happening to vultures, only observing that they're declining very rapidly.
And following that, the drug was banned for use in cattle, but that did not help with the vulture population growing back again.
So in 2006, India placed a veterinary ban on the use of diclofenac. It was not properly enforced, or it was hard to monitor and get full compliance. And in a way, there were still large quantities of diclofenac being used in livestock animals and still found in the environment. Since then, there have been other forms of medication that are similar to diclofenac or metabolized in animals and cause the same effect in vulture populations.
Tell us a little bit about what happened. You call it in your paper a negative shock to the sanitation. So do you think the sanitation of entire areas that housed livestock began to have a really terrible effect after the vulture population declined?
I think what is really important to recognize here is that we're not talking about a case where vulture populations declined by 2, 3, 5%. We're really talking about a setting where vultures were instrumental in disposing of dead animals in a country with about 500 million livestock animals that produce about 30, 40, 50 million dead animals a year that need to be removed. And that entire function got essentially shut off in a period of about 2, 3, 4 years. That functional extinction that vulture populations experienced was a massive shock to the system. And even though there were substitutions available, each one of them was prohibitively expensive in its own way.
The incinerators, for instance.
The incinerators, burying animals, vaccinating feral dogs in large quantities, all of those are possible but difficult and costly.
So this brings us back to the point about what happens now. So you said vulture populations have declined between 95 and 98%. Even after banning the drug for use in veterinary populations, you said that it continues to, however, remain around because the ban can't be implemented very effectively, or it's not being implemented very effectively. What happens now? Are there conservation efforts that can work?
There's ongoing effort to preserve some amount of viable populations of vultures, and those are protected and are fed meat that is known to be clean of diclofenac. Those are important for the future to be able to repopulate the area with vultures. But for that to happen, the environment first has to be safe for vultures. So the first step really has to be to make sure that none of those drugs that are so lethal to vultures are used in animal agriculture. The other approach that might help is, at least in the areas that are most affected, where there's the highest concentration of livestock agriculture, to consider building incinerators and constructing some mechanism that collects the animals from the animal landfills to those incinerators. One of the biggest benefits of vultures is that they will come to the dead animals. One of the biggest drawbacks of an incinerator is that you need to bring the dead animals to it.
Talk to us a little bit about what your paper spoke about, the necessity to protect keystone species. What is a keystone species and why should we protect them?
Ecologists think of keystone species as those that perform extremely important functions in the ecosystem, where a change in their population will lead to a disproportionate change in the functioning of the ecosystem. So examples are often earthworms that aerate the soil, sea stars that prevent infestations of barnacles and other clam-like species, and different animals such as bats and birds that provide biological pest control or important pollination services. And vultures are another example of being at that critical node in the system of removing dead animals extremely effectively in a way that other animals just cannot perform. What ecologists have told us is that it's really important to protect those keystone species, because those are the sort of dominoes that fall that then propagate throughout the entire ecosystem, lowering its functioning and resulting in negative impacts that can also affect a human well-being.
Just to round up, Professor, so the key takeaways from this you would say are to have incinerators where there are huge livestock populations in order to ensure that carcasses do not lie around, and to also simultaneously help in the vulture conservation efforts.
I would argue that the two biggest priorities now are to make the environment safe so that vulture populations can recover. But because that is going to take many years, potentially decades, for them to return to their former population levels, something has to be done now about the current amount of dead animals left in the open. And incinerators in the places with the highest concentration of livestock agriculture seems like a cost effective way of dealing with that.
Would that then subsequently reduce the number of dogs and rats? Would that have a cascading effect on that?
Yes, by removing the amount of dead animals that is available for dogs and rats, that should in turn reduce their population levels as well.
Thank you so much for speaking to us today, Professor Frank.
Thank you for hearing me.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.